Okay, we're going to be talking about the concept of infection, something we're all pretty familiar with. We've all had strep throat or an ear infection or influenza or a stomach flu. We've all been there, right? So hopefully this is something that's not too far of a stretch for you, but we're going to dive into this more as a concept of infection, both in your Giddens text as well as in Davis. So for your objectives here, go ahead and pause right now and take a quick look at your objectives for this concept. We're going to go ahead and start by defining and describing the concept of infection. So infection is considered an invasion and multiplication of microorganisms in the body tissue itself. So something that doesn't belong, especially not in that quantity, that's in our body and is now having an effect on us. Now, remember from boot camp, we talked about different types of infection, and we can categorize infections by 4 causative microorganisms, specifically bacterial infections, viral infections, fungal infections, and parasitic infections. Most commonly, however, we're going to be seeing bacterial and viral infections. Now, there's different ways we can describe an infection. We can describe it as systemic or local. Local meaning just, if you cut your hand and you've got some local swelling and local pain, but it's all right here, that's a localized infection. Whereas systemic means your whole body is involved and you're going to have symptoms and signs that involve your whole body. We can describe an infection by the duration, whether it's acute or chronic. Acute meaning short-lived, just happened, very recent, and chronic meaning something that happens over time. We can also describe an infection by its source. Did the patient get an infection in the hospital? That's not good news. That means we did something wrong. So that would be considered hospital-acquired. Or did they get it out at home, being at the grocery store, at their place of work, their kids' daycare? That would be considered a community-acquired infection. Also, we can describe the source as primary or secondary. So primary is, when I was in college, I would get a lot of colds, right? And so I would get a cold and I'd have nasal congestion and feel a little tired and maybe have a sore throat. That was a primary infection. It was the only infection I had. But sometimes that primary viral infection, my sinuses would get all clogged up, bacteria would start growing, and then I would have a sinus infection, a bacterial sinus infection that happened after or during my viral infection. And so that would be the secondary infection. So a secondary infection is one that happens during the treatment or the progression of a primary infection. Do you remember this chain of infection that we talked about at boot camp? There are these 6 points in the chain that have to be perfectly linked in order for viruses or bacteria or pathogens in general to multiply and spread. So you have to have an infectious agent. That's one of those causative pathogens: bacteria, virus, fungus, parasite. You have to have a reservoir. We are human petri dishes. These viruses and bacteria just fester in us. We are the reservoir. You have to have a portal of exit, some way for that pathogen to exit the reservoir, exit the person. So it could be through through a cut or through a needle. It could be through your mouth, through breathing, through urine. It has to be a portal of exit out of the reservoir. And then you have to have a mode of transmission. How is that pathogen getting from one reservoir to the next reservoir? So it can be things like coughing, an airborne, droplet, contact, all of those different modes of transmission, sexually transmitted diseases. Then you have to have a portal of entry, a cut in your skin, your nose, eyes, and mouth, a dirty needle. Those would all be portals of entry into the next poor soul who's the next reservoir. And finally, you have to have a susceptible host, a host whose immune system response is going to be unable to nip this infection in the bud. So things that make us more susceptible is when we're tired, when we already have some other illness, when we're stressed, All of these things can make us more susceptible. So if you think about when you start getting sick or your family member starts getting sick and you rush over to the Walgreens and you get a bunch of vitamin C drops and try to drink a lot of water, that's you trying to become less of a susceptible host to these infections. So this chain is called the chain of infection. And as nurses, we need to be really keyed in on this so that we can recognize this chain and know how to stop it. So when we do get an infection invaded into our bodies are kind of like the Pentagon. They're just the military ready to go, ready to respond when there is the sign of an invader. So you've got your B cells, and those are your memory cells, the ones that are going to go in, take note of the invader so that next time that same invader comes in, the body has a memory of it and will know how to respond quickly. Then you've got your killer T cells, that 1-2 punch, the phagocytosis. They're the ones who are going to help kill off this bacteria invasion. And then you have your complement system. The complement system is a series of proteins that is activated to enhance the overall response, and specifically, it actually breaks down these invading cells. And finally, you have the bacteria itself that are going to release endotoxins and exotoxins as they're being killed off, which damage the cells of the host and initiates this inflammatory response. So the body aches that you feel or the redness and swelling you see on a local infection, that's all inflammation. And we're all very familiar with that inflammatory feeling and body aches and seeing the redness and the swelling. That's all being initiated by or started by the release of these endotoxins and exotoxins from the bacteria, causing that inflammatory response. And so infection and inflammation really go hand in hand. So what I'd like you to do right now is I'm going to link you to a 9-minute YouTube video that really talks more about this pathophysiology of infection. And it does so a lot better than I could do in 9 minutes. So I'm just going to pass you over to them. If you're watching on YouTube, you can look for the link in the description box below. And if you're watching on Blackboard, the link is available to you as well. So go ahead and pause this video, head over to watch that 9-minute pathophys video, and then come on back and we'll finish this up together. All right, so you've watched your 9-minute pathophys. We're all understanding how the body's response to an infection works. Once in a while, we can't get good control of an infection. And when that happens, the body's compensatory mechanisms break down. They're overcome, and then we can see some real consequences to infection, such as septic shock, where the body is just overwhelmed with infection. Multiple organ failure can arise where your systems start shutting down, your kidneys, your liver, everything starts shutting down. And then eventually, left unchecked or uncontrolled, infection can lead to death. So we need to have a real serious sense of the importance of prevention of infection, early identification, and swift treatment that's effective, so that we don't get to these endpoints of uncontrolled infection and the consequences, because they are dire, and we certainly don't want that for our patients. So your complement system is a series of blood proteins that actually work to trigger a release of chemicals that attack the cell membranes, eventually causing them to rupture. And finally, the bacteria in your body actually release endotoxins or exotoxins, which damage the cells of the host and initiate that inflammatory response. Now, that inflammatory response is what happens when you get a fever and you feel junky and you feel all your body aches and you feel tired and you have a fever. All of those things are that inflammatory response caused by the release of those endotoxins or exotoxins from the bacteria itself. Now, normally, you and I are able to fight off infections just fine. All of those systems kick in and we're able to beat the pathogen invaders. But unfortunately, once in a while, that infection can become uncontrolled, either because the medicines didn't work, we didn't use medicines, we caught it too late. And once the body's compensatory mechanisms are overcome, we're going to see significant full body system failure in things like septic shock, multi-organ failure, and even death. And those kind of endpoints of disaster related to infection are real consequences and risks for our patients and things we need to be tuned into. But for the purpose of our fundamentals course, we're not really going to get into those just yet. So what are the risk factors for infection? Well, we want to think about what populations are at greatest risk for getting an infection. Now, infections potentially affect all individuals, regardless of their age, gender, race, or socioeconomic status. However, if you're thinking about susceptible hosts, here are the populations that are most commonly at risk: the very young, the poor who have poor access to healthcare, the uninsured, also because of lack of access to healthcare, or residents of a geographic area where an infection is prevalent. So if you thought about COVID-19 and areas having hotspots or areas having travel bans because of hotspots, we know that if an infection is prevalent in a specific area, we're going to see people in that specific area at much higher risk for that infection. So in our critical thinking course, we talk a lot about the Tanner steps, and the first step being that of noticing. So we want to know, what do we notice when we have an infection? So first, you're going to look for those general signs and symptoms. Signs and symptoms of infection can include things like fever, chills, pain, malaise, meaning, and just like that overall not feeling good, and then fatigue, meaning being tired. Now then, in those general signs and symptoms are going to be there for all infections, and you may not see every single one of those, like you can have an infection without a fever, but in general, those are general signs and symptoms of an infection overall. In addition, you're going to have some localized symptoms based on the body system involved. For example, pneumonia, we know, is an infection of the lungs. So we're going to have respiratory involvement. We're going to have things like a productive cough, meaning cough that you're coughing up gross sputum. And you might have shortness of breath. If you have the flu, you're going to have things like nasal congestion, sore throat, and headache. Remember, influenza is not the same as the stomach flu. So when we're talking about the flu, the real flu, we're talking about influenza. If you have a urinary tract infection, also known in our world as a UTI, someone with a urinary tract infection is going to have burning with urination, hematuria, which means blood in the urine, or urinary frequency, where they're going to the bathroom a whole lot. And then someone with a wound infection is going to have localized inflammation, redness, and swelling, purulent drainage, meaning that like nasty yellowy green pus, and redness. So you want to think of these generalized signs and symptoms that we're going to have for all infections, regardless of the source. But then we also need to anticipate what localized symptoms are we going to have based on the body system that is involved. So here's a list of some diagnostic tests that we can run when we are suspecting someone has an infection. We can run a complete blood count with a WBC differential. A complete blood count, or a CBC, is going to tell us a measure of the red blood cells, the white blood cells, and platelets in a patient's blood. Now, the WBCs, those white blood cells, those are the ones that come into play when you have an infection, and they rise to the occasion. And so with infection, you're going to see an increase of WBCs. Now, the differential just means that there's specific types of white blood cells that can be detected in a lab study, can give you an idea of how invasive this infection is, or even what kind of infection it might be. A culture and sensitivity is when we swab something specific or send a sample of a fluid to the lab, and then just like we did in microbiology class, they put those into a petri dish and then are able to grow them to see what kind, and then put them under a microscope and see what kind of bacteria or pathogen grow. And so you can do cultural and sensitivities, CNS, for things like urine to see if there's a urine infection. You can do blood. You can do sputum, someone coughs it up, or you can even do samples from a wound. And so we can really see what kind of microorganism we're talking about so we know how to treat it. A C-reactive protein, or CRP, is this nondescript lab study that indicates if there's increased inflammation in the body. Now, the CRP doesn't really give us a lot of details on where that inflammation is, but remember, infection is going to cause inflammation due to the endotoxins and exotoxins released by that bacteria. And so we would expect to see an increased elevated CRP level. The same thing goes with your ESR. It's another indication of inflammation in the body. And then finally, you can do different tests to detect specific antibodies or viruses. And when you went to nursing school and you had different titers run, they were detecting if you already have antibodies in your system, meaning you've developed immunity to specific types of illnesses. There are certainly different diagnostic tests like radiologic tests that we can run to detect infection. Most commonly, you're going to see x-rays, which I think we're pretty familiar with how an x-ray works, and also CAT scans, which are kind of like an x-ray on steroids. They take different slices of your body as x-rays and put them together as a 3D image, which works really nicely. Now there's also MRIs, which use magnets, and PET scans, which use radioactive materials in order to get different visualizations inside the body. And we can detect things like pneumonias through looking at a patient's lungs on an X-ray. And we could look at a bone to see if there's infection in a bone as well. So there's lots of different things we can look at visually through these radiographic tests. So what interventions treat or prevent infection from happening in the first place? Well, the first thing we want to focus on is primary prevention. We want to prevent infections from happening in the first place. The thing we want to encourage is for our patients to get vaccinations and to do so across their lifespan as appropriate. And you can look at the CDC website to make sure that you know what that recommended vaccination schedule is. And I won't be testing you specifically on that vaccination schedule. Just know that it exists, and it's a resource that you would need to know based on the patients that you see as a nurse. We also need to practice good hygiene, both personal hygiene, when washing our hands, and food hygiene, making sure we're storing our food properly and cooking it properly to avoid foodborne infections and illnesses. And then patient care hygiene. Oof, I can't overstate how important it is. And we never want to lose sight of the fundamental things that we can do that we learned our first 2 weeks in nursing school lab, which is hand hygiene and proper PPE. We just have to keep those at the forefront of what we do because this is primary. It's a lot easier to prevent infections than to treat them later. Now remember, secondary prevention, secondary, S for screening. Secondary means screening. And the most common things that we're going to screen for in terms of infections would be sexually transmitted infections in high-risk groups, and then also TB screenings in high-risk groups. And that can be done through the MAN2 test, that skin test under your hand with a little bleb, or you could use the quantiferin test, which you had coming into nursing school, also to test for tuberculosis. So these are highly infectious diseases that can spread quickly in a community and cause a lot of illness. And so we screen for these specific types of infections as a part of community wellness. Now, certainly we understand that we can't always prevent infections from happening. And when they do happen, here are some collaborative interventions that we do. Now, collaborative meaning nursing has a part of this, and then medicine has a part of this, and pharmacy has a part of this, but we work together to have a full comprehensive patient plan for treating infection. And so this can include things like antimicrobial therapy, most specifically antibiotics, either oral or IV, rest and comfort measures. Because the body is fatigued and has malaise, it needs additional rest in order to fight the infection and to decrease the susceptibility of the host and increase its immune system response. Our patients need to have proper nutrition and making sure that they have the building blocks they need to fight this infection. And fluids can be a part of that. When a patient has a fever, they're going to be losing fluids, and we need to make sure that they're staying hydrated so that they have good circulation and can get this pathogen out of their body. We need to disinfect the physical environment. We really need to watch how we're cleaning things and making sure we're cleaning not only our hands, but any soiled linens, and keeping a clean environment for the patient so that secondary infections can't be harbored. Now, think in mind, a lot of our patients have a lot of different tubes coming out of them. They may have a Foley catheter draining their urine, or a central line catheter giving direct central line access, kind of like an IV, but more invasive. And all of these tubes are places where little microbes can just crawl right in. And so we need to make sure that we have a clean environment around our patient as well as on our patient, doing good dressing changes and wound care and Foley catheter care to prevent our patients from getting infections from all those tubes and lines. I want you to take a look on Giddens, page 236 with me. So we talked about these collaborative interventions and how all the different interprofessional members of the healthcare team all work together on that plan of care for a patient. But on 236 of Giddens, this is what we own. This is what we do as nurses. And so that includes hand hygiene, personal protective equipment, using all of those PPE that you learned so carefully in nursing lab this semester. You putting the patients on proper isolation precautions. So you have to know the route of transmission to make sure your patient is on the proper isolation to keep them safe and keep everyone else safe by having them on proper isolation. Maintaining sterility. Some of the techniques and skills that we do as nurses require a sterile environment. We haven't learned those yet, but we will. And we need to make sure we maintain sterility in our procedures to not introduce pathogens into sterile technique. Collecting specimens for swab. Remember when we talked about that culture and sensitivity and how you can collect things like wound swabs, urine, sputum, all of those swabs and fluid collections are things that we as nurses, those would be samples we would collect. Medication administration, that is us all day. We give meds, we give oral meds, IV, IM, we give meds. And so giving medications at the proper time, the proper route, the proper dose, patient, remember those 6 routes, 6 patient rights? That's what we own in terms of treating infection for our patients. And then finally, patient and family teaching and education, not only teaching them how to manage an infection once they get it, which is important, but also how to teach them to prevent it, or how to teach a family to prevent the spread of infection within their home if someone gets sick. Teaching, remember, is always a big part of what we do as nurses. So take a look at this list on here, these nursing skills for infection, because those will be really key for you to know in terms of how your practice is. So let's take a look at these interrelated concepts from your Giddens text. Infection and inflammation certainly overlap. Anytime you have an infection, you're going to have that inflammatory response from those endotoxins from the bacteria. Nutrition is important to help treat infection so that our bodies have the building blocks they need to treat it. Tissue integrity can be compromised by infection. You can get an infection of the skin, of an organ, and that can cause tissue integrity compromise. Immunity, how strong our immune systems are, how capable they are at protecting against pathogen invasion will indicate what kind of infection we have and how bad it gets. And certainly stress and coping. Anytime you're sick and you don't feel good and you're missing work, or you're not knowing how to, get to the daycare because you can't take your kid to the daycare, or the cost involved in taking care of an infection and affording medications. Certainly this is a source of distress, not eustress, and can cause distress for a patient. And we have to help patients and their families navigate what are their coping mechanisms to get through managing that infection. So you see how all of these concepts are really starting to interlock. And that's because we are complex human beings, aren't we? And nothing works in a vacuum. So I hope you're starting to get a sense of this. And finally, here's our list of exemplars that's listed in your Giddens text. And specifically, we're going to be looking at these 3. Pneumonia, which is an infection of the lungs, influenza, which is a viral infection, and then a urinary tract infection, which we also call a UTI. So go ahead and specifically take a look at the pages in your text listed here, as well as the exemplar handouts that we've linked up for you on Blackboard.